Thai Global Health Initiative. This initiative was envisioned and brought to life by Venk Shukla, Thai Global Trustee and a past president of Thai Silicon Valley. For those not familiar with Thai, it was formed about 28 years ago to foster entrepreneurship amongst the Indian population. Professional graduates seeking jobs in the US were well versed with technology, but not with business. And they were hitting a glass ceiling. Thai provided a platform for them to start their own companies, become CEOs, get mentored, educated, and funded, and allowed them to network with like minded individuals. Today, CEOs and CIOs at many large enterprises are of Indian origin, thanks partly through the efforts of Thai. Thai is now a global organization and a brand with 60 chapters across the world and a large presence in US and India. The mission and vision of Thai Global Health is to bring together charter members from around the world that have an interest in health tech. Thai Global Health provides a platform that facilitates dialogue and interactions, exchange of knowledge and ideas, showcase technology, and bring together investors, innovators, and enterprises. We would like to use this forum to study the innovative solutions from startups, understand the gaps from enterprises, learn where the money is flowing through investors, provide knowledge through mentors and advisors, and use the collective connections to create a heightened momentum which can be tapped for the greater good, for investing, mentoring, advising, and showcasing of ideas. Our session today is centered around health assurance, and it is my honor and privilege to introduce you to Hemant Taneja, our speaker for today. Hemant is the managing director at General Catalyst and is the author of a newly released book on healthcare. Hemant has the Midas touch. Truly, he has made a series of very, very successful investments. He has that inner magic to spot unicorns early on, and some of his investments include Color, Grammarly, Livongo, Samsara, Stripe, ThoughtSpot, and the list goes on. He's also the founder of Commure, which is building a much needed software platform to transform the healthcare space. His investment thesis is based on the economies of unscale, focusing on helping startup founders leverage AI-based personalization to innovate across sectors. This was beautifully articulated in his book, Unscaled, which was published in 2018. His new book, On Healthcare, is a must read, and you'll hear a lot about it from him today. If you've not picked it up, you must do so. I feel it has some amazing nuggets of information. It's available on Amazon in a digital or a physical format, and it clearly lays out the thesis for how the healthcare system needs to transform into a health assurance system and outline some new business models that are coming into play. By now, you must know that Hemant is truly an overachiever. I was at Stanford, but my dream school was MIT. That is where Hemant went. And he didn't get just one degree, but I believe he got like about 6 of them. To me, there is a term in healthcare that we use to describe this phenomena. It's called totipotent. These are stem cells that can develop into any type of cell. Hemant clearly exhibits multi-toti potential, which means he can do anything, he can be anything, and often at the same time in parallel. His curiosity about new areas of innovation has brought him to this stage of his life where he's brimming with success stories. And today we are all very lucky to hear from him. The session today is a conversation between Hemant and Carolyn Savello, VP of Commercial at Color. Color is a population health genomics company in which Hemant is an investor and a classic example of health assurance in action. What Color has been able to accomplish illustrates how health assurance companies can transform healthcare. Carolyn leads the company's go-to-market strategy and the commercial team. She helps Color build partnerships with institutions around the world. She joined Color from Bloomberg, where she was the chief of staff and global health of strategy, and subsequently GM for Bloomberg Media. Carolyn began her career at BCG Consulting Group with Fortune 100 biotech companies and Gates Foundation. She's a graduate of Yale. We want this to be an interactive session, so as you're listening to the conversation, please feel free to post your questions in the Q&A box at the bottom of your screen. I will meet you again at the end of this fireside conversation between Caroline and Hemant, and we'll be back to lead the Q&A discussion. I would now like to hand over to Caroline Savello to begin this exciting discussion on health assurance with Hemant Taneja. Over to you, Caroline.
Well, thank you so much, Dipti. Really appreciate the warm introduction for Color and for Hemant. So Hemant, let's start with the book, because I think that's really the crux of the conversation here. And I know it's been really, really well received. So tell us about the book, about healthcare in the US. You published it with Dr. Steve Klasko, who is also a collaborator of Colors as well. And he heads Jefferson Health in Philadelphia. You introduced this concept of health assurance. Can you help everybody understand what you're talking about by that, and sort of, especially at this moment in time, what that really means to the industry?
Yeah, so Caroline, I think you probably don't know this. I don't think I ever mentioned this to you, but the phrase health assurance actually came to me sitting in a Color board meeting.
I didn't know that, actually.
Yeah, because what Color does is preemptively figure out how to keep people healthier, right, at population level. And that's akin to us all creating our 401k, which is around your financial assurance as you sort of live a longer life. And that's when I started to think about this. So the core philosophy behind health assurance is to build a 21st century healthcare system, which first and foremost is refactoring the entire system in the context of consumer experiences. So one of the companies that we co-founded in our offices was Livongo. And in that company, we essentially tackled taking on consumers with chronic conditions like diabetes and figuring out what is the right consumer experience we can build to help them live their lives. And as it turns out, at the time when we started the business, there were probably 40 companies working on diabetes, and every one of them had a design principle that were essentially based on, if I can get the diabetic consumer to come into the app and enter all their data multiple times a day, we will help them become healthier. But when you think about it, which consumer wants to think about their diseases 10 more times a day? Nobody does. You actually want a disengagement principle when you build that. So I think sort of thinking about those consumer experiences first and foremost is what defines health assurance. The second, and this is hard for a venture capitalist to say, but is to actually reduce the healthcare market. Everywhere else we invest, we're talking about TAM expansions and how do market sizes get bigger. It's a collective obligation that we actually reduce what it costs to enjoy health as a share of wallet, both for consumers and for businesses alike. So I think that's an important mindset. And the third core principle behind health assurance is around the responsible use of data. So AI and machine learning to me is garbage in, garbage out. And when you think about a lot of the data that's being used in the healthcare systems, it was largely captured in the context of billing. I mean, they have this joke in healthcare that when CPT codes change, diseases disappear. And so a lot of that data is actually not representative of the care, the actual conditions that the consumers might have. And so trying to use data responsibly in terms of digital interventions as we get more sophisticated in that regard, that's the third tenet of health assurance.
So I think tech would agree with all of those statements. I think a lot of health systems, a lot of healthcare leaders may not. How do you see that changing, and why isn't there more collaboration between tech and health systems and healthcare leaders, and how does that change?
Yeah, it's a great comment, Caroline. So when I first met Steve Klasko, Steve, for everybody's benefit, he's the CEO of Jefferson Health. It's about a $9 billion health system in the greater Philadelphia area. And I mean, he's this bold sort of visionary inside the health system that really wants to embrace technology and has made a lot of compelling sort of forward-leaning moves. When I first met him, it was at a dinner I had hosted with a bunch of health system leaders around the founding of Commure. And I said to him, you are the thesis and the antithesis of my first book on skill. And he said, what do you mean by that? I was like, well, what I've seen you do in the last 3-4 years is go from 2 hospitals to 14 hospitals. So it was essentially applying economies of scale to become a viable health system. But on the other side, all your talks are about being healthcare with no address, which is essentially this whole notion of bringing care to the consumer and virtualizing it. And how are you really going to get there? And I think the reason you find, you deal with this because you're selling to a lot of these health system CEOs, that some of them just don't get it is because they're so mired in the challenges of becoming viable today that it's harder for them to think about where they need to go. I think that's the issue that hopefully this sort of technology and healthcare collaboration can make surmountable, over the next few years.
Yeah, you're right. I mean, and I think Dr. Klasko, of anybody, has been like very much at the forefront of that. I mean, one other thing that I think is really interesting is this moment in time and the timing of your book right now at this moment in time when the healthcare industry, I mean, globally is just going to be completely upended. Can we talk about payers and where have they been in all of this and what does the future look like for them? Because I think that payer health system relationship is so fraught now and has to change and probably is very much related to kind of where you're seeing the industry go as well.
Yeah, the payer provider arbitrage is fascinating to me. There's so many companies in health that are applying machine learning to facilitate this arbitrage, which frankly is not an area that we're interested in investing, because essentially it's based on the premise that the payers think providers bill too much and the providers think payers pay too little. And so it's all this machine learning on both sides to figure out how to maximize whatever their objective is. And that just comes from, and you guys talk a lot about this as well at Color, is the fundamental issue is this incredible misalignment in this industry around who pays, who decides, and who benefits. Because of that misalignment, this is actually one of the reasons why technology entrepreneurs have difficulty building a business in this market as well, because it's just not rational. And I think the thing with the payers is what started out as providing catastrophic insurance for unanticipated healthcare challenges that might arise is now essentially become this integrated service where the payers are also going deep into providing healthcare services in this misaligned system, and they often do that as a loss leader so they can get folks into the payer system. And that model just doesn't really work. What you have to go to is a world where you have this health assurance mindset. You're literally investing in services that keep the populations healthy, and then you have an insurance product that is around catastrophic insurance. And this continuum today is part of, I think, what needs to unbundle in the next few years.
Yeah, I mean, I think especially now with COVID.
Carol, you deal with them. Like, what would you say?
Yeah, I was just gonna kind of comment on that because I think like with COVID right now, I mean, it's completely changing consumer expectations. I think of how they operate vis-a-vis healthcare, and we've been doing a lot of work with we basically tried to restructure a lot of our product early this year to be able to kind of jump in and help with the pandemic. We'd been providing large-scale population health services, including clinical genetic testing, and we had seen exactly the same challenges with the COVID epidemic and pandemic, which was, friction in the process for consumers and way too much overhead for providers. And if you could actually just change a lot of that, put a lot of that into software, you could totally change what COVID testing access looked like. I've talked to a number of people, in leadership positions across the US health system since then. And everybody's just saying, if you can drive down the street to a pier in San Francisco and get a COVID test without actually having to interface with a doctor, you get a text message when your results are ready from Color saying, what your test result is, totally changes your expectation of how you should, what you should expect from your healthcare system and from your doctors on an ongoing basis. So like the cat's out of the bag, basically.
Yeah, absolutely. I think the idea that you can build great consumer experiences, which is really what you're describing. I mean, it's entirely possible in this industry, right? I mean, when we started Livongo, just to give you a trip down the memory lane in 2013, sort of transforming this consumer experience was a core objective for us. And last year when we went public with an NPS that was higher than Apple. And I think that that's been inconceivable in the healthcare space, that consumers can actually get that kind of a service. But it's largely because of that misaligned system. I think a lot of the work that you guys are doing and other companies are doing brings forth that same sort of consumer experience expectation into implementation. That we're frankly, what you just described happens to us when we buy books from Amazon, right? I mean, it's like this 20% of GDP just has been lacking because frankly, tech has just left behind the sector based on a series of decisions over the last 20 years.
Yeah, yeah. And I think especially, I mean, as we were talking about earlier, especially with the sort of the misaligned incentives in the US healthcare system and sort of the friction introduced by payers in the mix, you know, it's interesting to see how different the healthcare experiences are in countries like Singapore, where, you know, Color, you know, our team has spent a lot of time where it is really about how do you actually get people to engage much more directly and on a daily basis in preventative activities and taking care of their health. And that's something that really is felt deeply by the health system. It's not really optimized just for acute care as a result of the payers really not being in the mix in the same way. And I think that's actually something that really has kept away a lot of technology innovation here in the US.
Yeah, no, absolutely. You know, while we're at it, if you maybe we should just talk about, you know, the transformation you guys had to go through to seize the moment around COVID as well. I mean, I think just for the listeners' benefit, we had this, just like every other startup in March, April. You know, it was just an awful couple of months because every board meeting you went to was all about what is the defensive strategy, how are we going to keep the employees safe, and what is the defensive strategy because we don't know what the world's going to look like. And you know, to give credit where credit's due, Caroline and Othman showed this incredible courage, and they actually came and said, well, we're going to increase investment and we're going to go take on this problem, A, because it's good for society, and B, because it's good for business. And they sort of took their population health rails and went down the path of from scratch, setting up a COVID testing lab, getting FDA approved, and now in 6 months are one of the largest testing platforms in the country. Why don't you just talk through sort of what you guys learned from that process? And I know you haven't even had time to reflect on this because it's just in sort of this tremendous scale mode. But I think it'd be good for everyone to understand the problems that got exposed that you had to overcome, you know, to get us through this pandemic. Which, by the way, we should stop thinking a pandemic is a black swan. They happen every couple of years, and we have to engineer out the devastation with technology. So why don't you tell the story, Caroline?
Yeah. Well, first of all, I actually remember that board meeting back in April. And if anybody is looking for an investor that is incredibly visionary and also extremely supportive of companies that are making bold moves, we are very lucky to have him in that boardroom alongside us through all of this. It's been a wild ride. You know, I think like when we it really was kind of like a weekend conversation almost at the time. I remember on a Saturday night, a number of us in the company were thinking like, we actually have these things, we have these assets that we know we can deploy here. I mean, if you take yourselves back to late March, you know, no testing was happening. People were getting results by a nurse calling them if the nurse remembered and had time. It was the same nurses that were in ER rooms, you know, admitting people who were having breathing difficulty. Yeah, there was no testing happening and nobody knew what was going to, you know, everybody thought it was going to be like a 4 to 6 week thing. We basically in the course of a week, you know, repurposed the software that we had been, you know, using for large scale testing programs in other segments in clinical genetics. We provide large scale genetic counseling services in the US and overseas. And we basically repurposed that whole platform and put it to work with COVID testing. And our first partnership was actually with the city of San Francisco, where I live here in California. And it was about how do we actually change the access model for people to get testing. We set up testing site, but really it was around the software, as I was mentioning earlier, being able to get a text message with your results, which at the time back in March, I know it only seems like it was 9 months ago, but was really different at the time. And I think what we've seen over the past 9 months is that, you know, at least in the US context, the public health system was so deeply ill-equipped to meet this challenge. And a lot of it was because of a lack of appreciation for an investment in software actually over the past decades. And also because of just the fragmentation and the reliance on traditional healthcare to be providing these services. And they sort of started there, the public health system started there. And I think the role of public health is just changing very rapidly now in the US, and I assume overseas as well, is happening very rapidly too.
Yeah. Yeah, I mean, I think so much got exposed in the last few months in terms of the lack of resiliency in the health system. I mean, I think the fact that we are just fundamentally missing this public health rails, if you will, the test, trace, isolate system that can use uh, the I guess the pun is intended here, the virality of social media to subdue the virality of the infections. In terms of like the technology platforms we've built, I think that whole infrastructure just needs to get created, and obviously you guys took advantage of some of that, and others have as well. I mean, the other thing, like we were going to publish this book in April, and when this happened, we took the time back to say, how do we just take everything we had written about and apply it? And so we did the addendum around the pandemic. I mean, if you think about it, pandemic happens, and essentially the entire health system does this student body left, which is we're only going to deal with the pandemic. So if you had a heart condition, or if you needed a hip surgery, or if you had any other issues, God bless you, come back next year. And then, in every other industry, when this happens, you're able to sell futures and live afloat. Health systems were literally like, okay, what do? We have no revenue, and we're all going to go bankrupt. And so, the government has to come bail out. So like the whole system it's just so brittle when you think about what we were dealing with. I mean, elderly care, when you think about the infestation zones they were, the nursing homes,
Yeah.
and sort of what happened there, it's I genuinely believe this pandemic, despite the negative connotations, the iPhone moment for the space, so many ideas that were bumbling along all of a sudden look like there's a great sense of urgency and momentum behind them. When you think about elderly care, you think about home hospital, you think about mental health workforces and mental health platforms, because a lot of those issues have gotten um, exasperated through this. I'm for the entrepreneurs that are listening, I can tell you, we actually put up a internal strategy doc about 2 months ago, where we put up a plan that in the next decade, about 20% of what we're going to do is going to be in this sector, and that's $4 to $5 billion of investment. And that's a lot of capital from an early stage perspective in terms of the kinds of projects you can take on. And it comes from the deep belief that it's a great moral imperative for the tech sector to take this on, and B, it is going to be one of the biggest, if not value creation opportunities of the next decade as well.
Do you think there are any parallels to any other industries in terms of like how important this moment is in the course of healthcare? Like, it seems to me that there's been these like just real sea changes that have happened in other industries over time that have created this huge expansion of opportunity. It feels like that moment in healthcare, but I'm curious if there are parallels that you've seen.
So I would actually say no, and I'll tell you why. I think most innovation happens from greed, not fear, right? In terms of iPhone comes along, and here's all these fun things we can do, and so the social media and entertainment sort of happens, and then you start imagining what could it do, in terms of digitally organizing society, content, community, commerce. The innovation from fear generally doesn't happen, because as human beings, we're not programmed to think long term. Is the issue? So pandemic is unique because it became existential in the short term. The place where I thought this might happen, I would say about 15 years ago, was in the climate change area, where there was this fear, but because you don't feel that right around you on a daily basis when you think about climate change, it doesn't really take hold, and it doesn't move the hearts and minds of the legislators and the policymakers and the entrepreneurs and the capital, everything in concert to say we're going to have to change. So I do think this is actually a very unique moment in time that we're dealing with in this sector.
Well, and then in terms of like, it feels very crazy to be prognosticating 10 years out right now with the way that the world is. So let's look a year out. What do you think the healthcare industry is going to look like a year and a half, 2 years from now, especially as the vaccines are being introduced and things may start to kind of quiet down? What do you think actually happens to some of these like huge kind of shifts that have happened in healthcare and with things like telehealth in the past year?
Yeah, look, I think the accelerants. So the adoption of virtual delivery of healthcare, digital delivery of healthcare is a thing. The new normal is not as high as it was in April, May, but it's multiples higher than this time last year, and I think it's going to compound. And I believe that because we've been working with a bunch of health systems, and everybody's thinking about this digital delivery. How do you sort of become a platform? Some of the stuff that Steve Klasko was talking about in terms of healthcare with no address, we're seeing everybody willing to make those investments, saying we have to evolve into that. So I think that's legitimate. I would say public health rails, a lot of the work you guys are doing is going to become core to us. Like every flu season, you don't know what to expect, and you're going to want a system that can very quickly detect if this is lethal or highly viral, whatever the flu season might bring us, and tackle it. So I believe infrastructure like the one you guys are building will be an enduring piece of infrastructure that frankly didn't really exist. I mean, you pay taxes for the government to do this one thing, and it's insane to me how lacking they were in their capability. When this mean think about what CDC was able to do and not able to do, and so on. So I think that happens. I do think the home hospital area is a legitimate one, bringing care to the home. It's like this is where the hospitals can learn from hospitality. There's like that Airbnb like thinking, right? They just filed to go public yesterday for investors there. So it's top of mind. I think that's sort of an interesting um, core piece of infrastructure that's going to happen. And then the place where we spend a lot of time thinking about is if we're truly going to move towards a world of health assurance, you can't do that without transforming the workforce. So, we're building about 20 companies in the space, and some of them are squarely going after how technology brings automation. So, the biggest workforce in any of these hospitals, this, is in the back office doing billing.
Mhm.
That's a great thing for software to do. And frankly, those jobs should go away. But we should take those people and train them to go out in the field and deliver empathetic care. The elderly need to be taken care of. The folks with severe mental illness, there's 8 million of them, need to be taken care of. And so I think this workforce transformation in this industry over the next couple of years, we will hopefully start to see that is also truly taking hold, because that to me is an early indicator. Because to change the outcomes, you have to change the workforces.
Yeah, yeah, yeah. We've spent time on thinking through that as well, and like our belief here, and I think this is so actually not the way that healthcare has operated historically, but it will have to now because of the capacity of the system. Is just you have to enable people to practice at the top of their license, and the things around that, all of those workflows, all of those sort of administrative overhead of the system today can be replaced with software. You totally change the efficiency of the system, and also just like job satisfaction and the quality of people's work when they're actually able to do the things that so many people come into healthcare for, which is interacting with other people and helping and caring for them. So we agree with you on that one.
Yeah, absolutely.
Okay, so maybe I'm kind of shifting back into the entrepreneurial side of things. Especially today in the middle of a pandemic. I mean, you've talked about where the kind of focus areas should be from a healthcare perspective. How do you think about entrepreneurs in times of crisis and like how they should be operating today in an extremely dynamic environment where everything is kind of being thrown up in the air again?
Yeah, I mean, I think the framework we used um, for our CEOs, and we ran a lot of working sessions with them over the last few months. You guys attended some, and it was always about, as I was saying earlier, sort of, take care of the team, play defense, play offense. Because as Winston Churchill says, never let a crisis go to waste. I actually think the most um, sort of acceleration a business can see is in how you respond to crises like these. So I think to that end, um, trying to be comprehensive in your understanding of the different stakeholders, and in terms of culturally what that evolution of the system needs to be, and moving towards that, a little bit like what you guys did, which is, hey, we're population health, genomics is interesting, but also handling pandemic, which is sort of a great need and becomes this enduring piece, like we need to add that to our capability, right? So I think businesses that are thinking with that kind of sort of forward leaning understanding of where this infrastructure needs to head are going to do very, very well. And to me, culturally, that only happens if you have the different stakeholders in your company. You need the people that understand the agility and innovation technology can bring, but also, empathy for the stakeholders and for the consumers that you're serving, as a business. And how do you really move towards what's needed? It's. I mean, I was looking at this chart the other day. There's probably 30 to 40 billion plus dollar value companies in this space right now. I think when we look at that chart in like 2 or 3 years, that's going to like double or triple. And if you look at that in 10 years, I mean, it's going to be 20, 50 plus billion-dollar market cap companies that emerge that have essentially done this digital transformation of healthcare. So I mean, this is irreversible to me. I think it's global, and finally, there's a sense of urgency to let technology come bring innovation into the space, which has been an issue for a long time, as we well know.
Yeah, yeah. And on the investor side, I mean, are you in the investment community? Are you seeing money coming in? Like, are people really trying to make big bets now? And are they interested in the space, or they're kind of waiting and seeing?
I think the many senior investors I've talked to over the last couple of months, they're all thinking about how do we get into digital health. I mean, there's probably 8 or 10 firms that have been spending time in this area with sort of enough concentration, but there are many others getting, which is a good thing. I think this is, you're talking about $4 trillion of value that's going to turn hands. Like I think we all need to chip in and help accelerate that innovation.
Yeah, yeah. Could I ask a question as well on Teladoc and Livongo this year? That was another big kind of, you've had a busy year. And in terms of kind of like where that space is going, and how do you see companies like that actually transforming? I mean, because, that merger was a big deal in the space. I think actually the biggest deal in the space actually this year. But what does that mean for the future and for those companies? And where do you see that going and transforming the way people are thinking about their care?
Yeah. So just a little bit of a backstory there. Look, I think the choice for the two companies, and I had to meet Jason in Detroit because that's the only place we could both show up, given the pandemic. It was very clear that these two companies were going to go right at each other, and the end outcome for that would just be is the insurance companies that win again, or you could actually combine and build a 35 40 billion dollar market cap health system that has software like margins. We thought it was important enough to go create that this merger made a lot of sense. I think this has shown a playbook. I also think this is a platform that now has 70 million plus Americans that are getting primary care, and millions that are getting chronic care, all as a continuum in sort of single platform. Now they have to go integrate these companies and rethink that health assurance experience by combining these two offerings. So there's a lot of work to do there. But I think the vision for what that can be is, to me, a playbook that others can follow, because the same thing needs to get done in many other chronic conditions that Livongo never got to. Musculoskeletal is an example of that. Severe mental disease is another example of that. And then also, I think it also shows a blueprint for sort of how a company ought to be built, and how do you think about working with insurance companies or on a cash pay basis. So Teladoc's got both sort of direct to consumer and insured businesses. So I'm very optimistic. There's going to be many more behind this.
Yeah.
As I said.
Yeah. I think they're totally paving the way for something really interesting in the space. Dipti, I'm seeing tons of questions. Should we toss it to some other folks for a bit?
Yeah, no, this was great, Hemant and Carolyn. I mean, I guess we could keep on going with this discussion forever, but you're right. There's a lot of questions coming through, and I loved how you, just brought in this question about Teladoc and Livongo, two companies that could have competed with another, but instead now complement one another, and by the merger, it's a brilliant, brilliant move. and another way of going forward with healthcare. So let's take a look at some of the questions here. We have CEO of Citizen, Anil Sethi, asking a question to Hemant, I guess. What's your thesis on patient-controlled data liquidity? Data is precious. Everybody wants to own it. Where do you see this going? Is it going to be federated? Is
No,
it something different?
I have this dream that someday we'll just be able to literally go to the 320 million Americans, whatever the population will be at that time, and just give them all their data and flip this model on its head. And I think the more these consumer experience companies like Color and Livongo, Teladoc, exist, the easier it's going to get, because this data is sitting in systems that are more liquid than the traditional EHRs. I mean, it's sort of interesting when you think about what's happening in the space, because on one side, in the physical health systems world, there's this massive consolidation of the EHRs, right? Epic's kind of taking over all the largest systems. Cerna's got largely the mid-tier, and then there's this fragmentation, but it's all consolidating. On the other side, though, every company, every virtual company that gains scale, like Color's got its own EHR, Livongo's got its own, Teladoc's got its own, Mindstrong's got its own. And so there's actually proliferation of these modern EHRs with teams where their business models are much more aligned with empowering the consumer versus creating sort of their closed systems. And so the more these companies are successful, the easier that problem is going to get. And then someday we have to pull it together into, here, Deepti, here's your health dossier, and you can activate that wherever you want to procure care on a real-time basis.
So patient will own his own portal and then will allow access
That's
as
the dream.
they want to do it. I'm
That's the
looking
dream.
forward to that. Here's another question. Subhashish Sarkar, when we talk about preventative healthcare, we should have regular screening or diagnostic tests or health checks, etc. Is that warranted? If so, will that be something that the providers will introduce as a hygiene? If not, how do you prevent without personalized data? More so, I mean, I'm also seeing these models are very different around the world. What we see in India is very different than here. So how do you see this all panning out? Should we go proactive? Should we do continuous monitoring?
Caroline, you want to take that?
Yeah, I think I'll state my own personal view of the way that healthcare works today in the US, at least, which is because of the payer system, the way it is, we are completely built for acute care, 100% for acute care and not for preventative care. And so the way we even think about investing in preventative care, there isn't even like a model for that in the US system today that is like well accepted. And in reality, the investments that you can be making in earlier kind of screenings and in basically like the risk stratification that can happen across a population. And this is really like what Color actually does is, for you to be able to be much more targeted in where you put your interventions at a system level into what groups of the population is really what will make things work much better over the long term and save on costs and improve outcomes. And I think like that targeting, it's less from our perspective, it's less about even just the individual receiving something that is personalized for them, but really thinking about the system as a whole and where are you placing your resources and being able to use kind of data and technology to understand where those interventions should be targeted over the course of a population's lifetime. And we see some changes happening here. I think actually this is another one of our big bets from the pandemic is how systems need to change the way that they manage the health and safety of their population. And target those interventions and those resources accordingly.
Yeah, and I think that's spot on. And the thing about prevention is this is a little bit like climate change, which is if I do all these things today, then 30 years from now I'll have less issues, right? And so I think creating incentive structures and experiences that get the consumers to do this is where that challenge lies, and because otherwise, we're lazy. Human beings are lazy. We don't do preemptive. Prevention is not something we would do unless you make this a technology problem from an experience and an incentive perspective. And I think that's what Color has been able to demonstrate. I think it got accelerated because prevention became existential today.
Yeah.
And now our hope is that we can learn from this and understand that this could happen any moment. And we really do need to have sort of a prevention system that's always working in background. I think
Yeah.
that's really sort of, if you ask me today versus January of this year, like what's that core piece of infrastructure that's just like suddenly highly urgent? This is it.
Yeah.
Yeah, yeah. So putting the health back into the hands of the patient and making them responsible, that's the message. Also wanted to bring up another point, because we have a lot of innovators here in the mix today. Your message has to the innovators or the entrepreneurs has always been dream big, but keep it real, right? In your opinion, what is the winning formula for building great companies? And what advice would you have for these startup founders here on creating or building a startup that will last, right?
Yeah. So I think in healthcare, um, I've, I've been in the space for 15, 16 years now, and there was this pattern, and you would see technology. There are two archetypes. There's the technology founders that'll come and say, hey, I was successful at Facebook or Google, and I really want to do something good for the world, and I can use my machine learning or my fancy software, and I want to apply it to health, and the software will just do all the magic and will just transform healthcare. There's like that ends up being like, this is like the Silicon Valley episode bastardization of like every presentation, but that's what it looks like when there's like a completely technology angle on a company. And then there is, I'm a physician or I've been in the space for a long time and I see this one problem. I'm myopically focused on this, and this is how I've hired some software contractors and I'm going to solve this problem. And because I solve this problem, it'll transform healthcare. That's the other archetype. The reality is they're both completely incomplete. And that's one of the reasons, as Caroline was saying, we were able to create a large outcome in the healthcare space because we didn't fall into those traps from the beginning. I mean, I'll tell you a little story. I brought Glenn Tolman to the Bay Area in 2012, and we did a speed dating with like 8 tech CEOs doing healthcare. And Glenn, at the end of the day, very politely said to me over dinner, Hemant, that was great, but these are not going to make it. You realize that, right? And I was like, exactly right. But if we can actually put together a culture that is truly foundationally healthcare and technology at the beginning, so that you have those different stakeholder perspectives. To me, this is diversity. Okay, when we talk about diversity, like that kind of sort of a thought process, that you will build these experiences that fit in that health assurance mindset and actually can scale. And that's my biggest advice, which is from the beginning, try to create these interdisciplinary cultures versus, oh, I'm going to bolt on technology later, or I'm going to bolt on the healthcare perspective later. That just puts you a step back in your ability to succeed.
It's great. Yeah. So think big, think across the whole spectrum and see how you can solve the problems that exist. Another question from Anand Shashadri. Could you please share your perspectives on the state of mental health at large today and the most critical areas of change needed? I mean, I think COVID has brought this out again, even more so in the open. So what do you?
Caroline, you want to take that? You want me to take that?
I can give my 2 cents, and then you should give your opinion, given your work in the space. But I think, like, I think our view, I think so much about healthcare utilization, including mental health, is really about the friction of the process of access. And we've seen this in our work on testing and on population health services, which is, to whatever extent you can make things convenient for people and really push it into their daily life, push it to the edges of these communities. I mean, so much of mental health is also affecting, actually very similar to what is happening with COVID, which is affecting very under-resourced, traditionally underserved communities. Those are really the areas where utilization of these services is often the most difficult. When you change basic things and what it means to Hemant, your point around like the experience of it, how simple is it to access by just your mobile phone? How private, how convenient, how does it fit into your workday? We've done kind of like clinical genetic testing programs and large population health programs with union populations, for instance. We work with the Teamsters Union on the East Coast, and this is a population that, half of them didn't even have an email address. Most of them had not been to a primary care visit, on schedule for the past several years. And a lot of that was because they had to take off work, they're single parents, they can't miss, they can't take a sick day, and being able to actually receive a clinical service at home that fit in with their schedule and was easily accessible to them and very like kind of friendly in the context of their life actually totally changed the utilization there. And we wound up having, 10 times the utilization of some other more traditional healthcare services that were really broad-based for the Teamsters population. And I think that's exactly the same thing that's confronted a lot of mental health services, and actually where a lot of the companies like you're invested in, Hemant, are really trying to change a lot of that access model.
Yeah, look, this is one of the biggest issues, right? I mean, the digitization, one of the things it's done is created these echo chambers and all kinds of stress, all of it from kids to kids and beyond. And we think it's a massive epidemic. And the biggest issue, in our opinion, is we don't have a measurement system for mental health. So the reason we could build Livongo is because there is blood glucose measurement in the A1C. And you can then, based on that, create these sort of digital interventions and physical interventions and whatnot. Mental health was a taboo disease, right? It's not even acknowledged. If you look at the last time there was an interesting medication developed was like 20 years ago. Now there's a bunch coming in the pipeline because folks are starting to recognize this is real. And I think a bunch of work still needs to be done. There's about 850 mental health companies, so I'm not encouraging people to go start another one unless you had a unique angle. But I do think there's something missing, which is it's all based on the assumption that if we can intervene and have an empathetic conversation, we'll change the outcome. But we need to measure and have that sort of tune what we're providing, and that doesn't really exist yet. So I think there's a lot of sophistication that needs to be brought into the space over the next, in this sort of next phase of these companies.
Some kind of a quantitative biomarker that can evaluate the health status of an individual.
Exactly right. Yeah.
Yeah. Someday. So there's another question here. I know there's a lot of them, but so talking about mental health, but there was one that was about investment, and I thought that that would be really right up your alley to him. And as an early and considering the fact that you mentioned earlier on, we have the payers, we have the providers, and then there are people who pay for your insurance, and then we have the patient, etc. As an early stage entrepreneur, this Pankaj Jetwani is asking, how should one look to partner or sell into the providers or the healthcare systems at a time when they're hurting? They, like you said, the elective procedures have been pushed out. That's their money making, their jam on their bread and butter. And they're crunched with bandwidth, they're crunched with budgets. How can a early stage entrepreneur position his or her startup so that they can sell their product into the healthcare system?
Yeah, um, there's a counterintuitive comment I'll say. We invested in a company in March, right when the pandemic was taking hold, and I remember having this conversation with the founder saying, "Look, we think this year is going to be terrible because these health systems are losing money. They're not going to be able to have budgets to do pilots or sort of new things. And but we're behind you." Okay, that was literally this sort of conversation because the founder was just freaking out. And it turns out that company beat its plan that they gave us before March. And when I reflect on that, I think one of the reasons is hospitals are not going to go away, right? It's a core foundational pillar of society. We need them. And because of this lack of resiliency, I think it's been a wake up call in many, many of them that we have to change. So I actually think the desire, the courage, the conviction to innovate and set aside resources to do that has actually increased. Just based on, I probably have about 20 data points that are reasonably well informed. Based on that, I would say that's actually happening now. That doesn't mean they're going to go do everything because there is a resource constraint as well. So my advice to the founders, as I think about it, is you have to align with what their key priorities are. So this is actually a great time to go on a listening tour and understand how they want to change versus trying to push an idea uphill that you may have had a year ago because all their priorities are upside down. So I think like what great founders do, stay first principled and go listen and see how your market has changed to the extent that you're trying to work with these health systems and evolve from there.
Also, another question on the hospital systems is, you have the payers and then you have the providers, and then you're now seeing more and more models where the payers and the providers are merging. Is that a better model? Is it more efficient? What are your thoughts on that? Where do you think we
So,
should be moving
so I think
towards?
success requires rational economic behavior in the end. Okay. And that means um, want to see alignment in the who pays, who decides, who benefits, going back to the earlier comment, and the most widely profitable health system is Kaiser,
Mhm.
because they have that complete alignment. So they are, they're not addicted to heads and beds, which is like the way health systems operate, right? And I think if somebody asked me this once, what's the one sort of truism today that just won't make any sense 10 years from now? It's going to be this notion of heads and beds. I think
Mhm.
the idea that we're going to be volumetric system going forward a decade from now, I do think that's rapidly changing. And so some of that is happening because the payers are coming to providers saying, hey, why don't we just run this operation for you? We'll take the risk and we'll do this and we'll just give you its standard sort of operating margin, but let us do the whole thing. Because I think they're looking to figure out how to create the alignment. Health systems are saying, we don't want to be captive to these payers. Why don't we bring in technology and take risk ourselves so we can do the same thing? So I think there is these countervailing forces that are both going towards making this industry much more sort of rationally behaved, and that's a good thing for us. And I think that'll actually move